If you think we've seen it all, then you're about to witness something even crazier. It sounds almost impossible, yet it's true. Surgeries in the metaverse. In this video, we'll take you through this shocking journey of how advanced tech has become. So sit back, relax, and make sure to watch all the way until the end of this video to see some trippy stuff. And remember to click that like and subscribe button. Let's get started. The rise of the metaverse has been a hot topic ever since Facebook changed its name to Meta. As explained by Mark Zuckerberg, the metaverse is a revolutionary technology that offers virtual spaces where people can connect and collaborate with others who are not physically present. While the potential of this technology is promising, there are still many unanswered questions, particularly regarding its impact on the healthcare industry, such as in surgical procedures. But recently, there's been some massive breakthroughs in the world of surgery in the metaverse. So let's take a look at what it could mean for the future of healthcare. The announcement of Facebook's rebranding to Meta in October 2021 caused a seismic shift across the internet, sparking discussions about the company's future and the reasoning behind the name change. CEO Mark Zuckerberg himself stepped in to address the confusion and explained his grand vision for Meta. He saw it as an opportunity to transform Facebook's image from a mere social network to a cutting-edge tech innovator that was paving the way for the next level of online engagement, the metaverse. The metaverse was envisioned as a digital universe where people could interact with each other in entirely new ways and own digital assets. It was a revolutionary concept that promised to unlock endless possibilities for online interaction and create new economies in the process. The metaverse represented a whole new frontier that was yet to be fully explored, and Zuckerberg was determined to lead the charge. One thing was for sure, we were on the brink of a new era of online engagement, and it was going to be a wild ride. And that happened because Metaverse brought a lot of experiences to our world. The Metaverse was much more than just a digital universe. It was a collection of interconnected technologies that included blockchain, augmented reality, virtual reality, and game theory. The possibilities that this new world presented were limitless, and it was only a matter of time before people would be able to explore it in all of its glory. One of the most intriguing aspects of the metaverse was the ability to create a virtual avatar and interact with others in a fully realized 3D world. This virtual space offered an entirely new level of social interaction that was unlike anything we had ever experienced before. Suddenly, it was possible to connect with people from all over the world, regardless of where they were located. Meta's acquisition of Oculus in 2014 was a strategic move that set the stage for Oculus to dive into the healthcare sector. With a renewed focus on the practical application of virtual reality technology in healthcare, Oculus is exploring new frontiers that challenge the traditional notion of physical interaction between doctors and patients. While in the past, patients had to make the journey to the doctor's office for diagnosis, treatment, and surgery, the COVID-19 pandemic has forced the medical industry to rethink the way it provides healthcare services. Telecommunication platforms have become the norm, enabling patients to connect with their doctors virtually. This transformation in healthcare delivery has been a game changer, as it has eliminated the need for physical visits to the doctor's office. With the emergence of the metaverse, we're witnessing a new era in healthcare delivery that takes the virtual doctor-patient relationship to the next level. To aid healthcare professionals during the pandemic, Oculus partnered with the WHO Academy on an innovative project that produced a mobile application to help manage COVID-19 patients using virtual reality. The resulting application offered an immersive experience of COVID-19 standard operating procedures, providing guidance on the proper use and disposal of personal protective equipment, PPE, among other critical practices. The impact of this collaboration was significant, as it helped medical practitioners around the globe tackle the challenges presented by COVID-19, leveraging the power of virtual reality technology. By embracing innovative approaches like this, we can continue to push the boundaries of what's possible in healthcare, ultimately improving patient outcomes and driving progress in the medical field. The impact of Oculus VR technology extends beyond healthcare professionals and into medical education. At the University of Connecticut, students are leveraging VR headsets and simulations to learn complex surgical procedures in a way that was previously impossible. By using these simulations, students can hone their skills and perfect procedures efficiently, allowing them to develop into highly skilled practitioners. The university has developed customized simulations for various medical procedures, giving students the ability to practice multiple techniques at any time. However, the benefits of VR technology are not limited to students alone. Even proficient surgeons can leverage this technology to prepare for complex surgeries. The recent surgery of Brazilian conjoined twins, Arthur and Bernardo, serves as a compelling example of this. The twins were born with cranial pages, a condition that left them connected with only a few skulls and intertwined brains that share vital veins. Through the use of VR technology, surgeons were able to simulate the procedure beforehand, preparing them for complex surgery and increasing the chances of a successful outcome. The surgical team, led by London-based surgeon Nora Awazi-Galani of Gemini End-to-End, was determined to achieve success in the complex surgery of the conjoined twins, Arthur and Bernardo. To help them prepare for the challenging procedure, the team utilized advanced virtual reality technology to rehearse the surgery beforehand. The process began by collecting data from CT and MRI scans, which were used to create a 3D model and a virtual reality representation of the twins' brains. This model allowed the surgical team to study the anatomy of the twins' brains in greater detail, enabling them to develop a precise and effective strategy for the surgery. By leveraging the power of virtual reality technology in this way, the surgical team was able to significantly increase the chances of success in the procedure, ultimately achieving a positive outcome for the twins. After the 3D model was prepared, it was sent to an international medical team, who spent months preparing for the complex surgery of Arthur and Bernardo. Here, the metaverse played a significant role, as the surgical team conducted a cross-continental trial surgery using virtual reality. The team members from different parts of the world connected on a virtual platform to test and fine-tune the techniques required for the surgery. With the help of virtual reality, they marked precisely where to make the incisions and how to reconstruct the skin and tissues to separate the twins safely. After 7 surgeries and hours of intense effort, the team was finally able to successfully separate Arthur and Bernardo. The team was thrilled with the outcome, as the success rate for such complex surgeries is typically low. Gemini Entwined released a statement noting that the separation was the most challenging to date, as the twins were almost 4 years old and had a fused brain. With the help of virtual reality technology in the metaverse, Jelani and her team were able to minimize the risks involved and successfully execute the surgery, providing a shining example of how virtual reality technology can revolutionize healthcare. The implementation of telepresence in the metaverse has the potential to completely transform surgical procedures in the healthcare industry. Telepresence involves the use of remote-controlled robots to perform complex tasks from a distance. In the medical field, this technology can be used to allow doctors to control robots and perform surgeries from far away, reducing the need for physical presence and travel. One example of this technology is the Pillbox, a small remote-controlled submarine that can navigate inside the human stomach and send a real-time video to a doctor's computer or phone, making endoscopes more efficient and cost-effective. The metaverse has already made significant strides in revolutionizing the healthcare industry through virtual reality, augmented reality, and telepresence. As technology continues to advance, we will likely see even more innovation and game-changing applications in the future. What are your thoughts on the impact of the metaverse on healthcare? Let us know in the comments below, and don't forget to like and subscribe for more insightful content.